Hi, I'm Jim Koske, physical therapist at Orthopedic and Spine Center. And today I'm going to talk to you about something that may cause back pain and then a couple of things that you can do to help prevent the back pain from getting worse. So what I'd like to talk about is what's called the hip flexor muscle. Hip flexor muscle attaches to the front part of our leg, right up in this area, and it goes up and attaches to the inside of our hip, and then it comes up and attaches to our spine. This is on the other side as well. So if we sit a lot or if we have irritation in this area, what happens is the muscle will pull our back forward, causing a strain in that area. And so when we go to try and stand up after we're sitting for a while, it'll feel like we have to stretch out, when you're getting up. So you'll come up and you feel like, you stretch back a little bit, and then it feels a little better. So this muscle here can get tight quite often. And so we have a couple of strategies to help you try and loosen that up to take some strain off your back. Okay, so now I'm going to show you a couple of stretches to help with that hip flexor, to stretch it out and to inhibit it and to try and make your back feel a little better. So the first exercise is called the upper trunk rotation stretch. What you're going to do is you're going to sit in a chair or on a bed. You're going to put both hands on one side of the bed, just like so. Get a little trunk twist in there. The key is to drop the head down, and what that does is tensions everything. So you're going to feel a stretch. You should feel a stretch all the way from your head all the way down to your tailbone. I recommend 30 seconds to a minute hold on each side. So he's going to hold on this side for 30 seconds to a minute, and then he's going to come on over to the other side, same thing, and drop his head. Now you don't need to go aggressive on this stretch. All I want is just a little bit of a stretch. And you can do this in a chair as well. Next up, he's going to go ahead and lay down on his back. We're going to do what's called a hip flexor stretch. So he slides all the way over to the edge of the bed. The inside knee is up like so, and he's going to let his leg hang down. Now some people's bed may not be high enough, so his leg may be touching the floor. To help with that, he's going to grab his knee, pull it into his chest. Notice how it lifts up his leg. So it's off the floor, and he's still getting this stretch right up and through the quads, the front of the thigh, into the hip. You may even feel it in your back a little bit. And what I would recommend is staying in this position for at least 2 or 3 minutes at a time. And then you're going to slide over to the other side and do the other side as well. So those are 2 stretches. Now 2 strengthening exercises, or called inhibiting exercises. He's going to slide to the middle of the bed. And we're going to do bridges. Now how we do bridges, you can do them 2 ways. He can have his feet flat, knees are separated, and he's going to lift his bottom up off the bed, nice and high, all right, squeezing at the top. He's going to hold it for 5 seconds, 10 repetitions. If this is too easy to advance it, he's going to lift his toes up. So he's pushing through the heels, he lifts his bottom up. He's going to feel this a little more in his hamstrings and his glutes. And what this does is when these are active, the hip flexor kind of like relaxes. So he's going to do, like I said, 5-second hold 10 times. The last exercise I'm going to show you is called the bird dog exercise. He's going to flip over onto his hands and knees. For this one here, you can have several different ways of advancing this. One is just to raise his leg back and lifts it up. Now you want to pretend like you have a glass of water here. We don't want to tilt this way. We want to have a nice flat back, and it's going to squeeze in his butt and his hamstrings. And then he brings it back down, and then he alternates to the other side, trying to maintain that flat back and bring it down. Now if that's too easy, he's going to add in his arms. So it's opposite leg and arm. So he's going to do his left leg, right arm out in front. When he gets there, he's going to lift up on both and get a good contraction right in here, and then he brings it back down, and then he switches over to the other side. And lifts up, squeezes, and feels it right there. Okay? So those are a couple of quick little exercises for you to try and help your lower back heal and get a little stronger. So if you need more information, you can go ahead and contact us at OSC, at Orthopedic and Spine Center Physical Therapy. We'd love to help you out. Have a great day.